Okay, well, so with no further ado then, I want to introduce Janet Turan. She's a professor in healthcare organization policy in the School of Public Health. She does really great work in the area of stigma and HIV and in and around Alabama, in and around places in Africa. So really internationally known. Teaches a course, probably more than that, but in mixed methods in the School of Public Health that always gets very rave reviews. So for anybody who hasn't ever taken that, if they're interested, I think there's a lot to learn there. And we're just really lucky to have you here today.
Well, thank you so much.
Before you go, let me just add one other thing, just a perspective. So I think a number of us have trained in epidemiology, and when I did my epidemiology training, I never had any exposure to qualitative research. And having now been on the receiving end of grants that I've written and on the reviewer side of grants that I've read, I will tell you that you want to get this right. You want to understand qualitative methods because it's a very easy way to get burned writing a grant, and people that don't know how to do it and that try to do it really make a mess of it. So I think this is a good start, and I look forward to her talk.
Thank you. Yes, you may find people on your study section like me. It's you don't do it right. So yeah, I'm really happy to be here. It's great to see some faces who have taken my class in the past or recently, and so for those of you, this will be a little bit of a review. It's a kind of a really basic introduction, but I also want people to share any examples of qualitative work that they're involved in currently. So just to start off at really the beginning, what is qualitative research, or why do we do it? So we're really trying to understand a topic from the perspective of the people who are really experiencing the issue, right? We want to know things about their values, their opinions, their behaviors, their social context that really inform why they behave the way they do. And so we can really learn how people as human beings experience the issue, the human side of how it feels to go through a certain health issue, and really get into some of these less tangible factors that are really hard to measure with epi or some other methods like social norms or gender roles or religiosity or ethnic identity or stigma, my favorite topic. So this really can get you a rich and complex understanding of a specific social context or a phenomenon. And so, when you really want to know why things happen, okay, maybe in other methods you might learn how much, to what level, how it's associated with other factors, but if you want to know why and how and under what circumstances things occur, you should choose qualitative methods. It seeks a depth of understanding. We're not talking about surface stuff, we're really trying to get in deep. We're also trying to look at social phenomena holistically. Not in isolation, but really the whole context of people's lives. It's often very exploratory. Sometimes you use qualitative research when you really don't know much about the topic, right? You're just like, wow, I see this problem happening, but I have no idea why. And so you want to explore and discover. And you want to be able to, you can get insights in why people make certain decisions and why they act the way they do. The methods of qualitative research, and we're going to talk about it a little bit, are very different than quantitative tools. They're often very open-ended and kind of loose. They're open to people giving us information that they want to share with us. And often our methods are not strictly fixed at the beginning of the study. You may propose and think you're going to do it a certain way, and then based on what you learn, you can actually tweak and change and enhance your methods and your study design, which of course then quantitative is not something you would do. So again, emergent rather than pre-structured. We really feel like the people that we're studying are active participants in the research. Together with us, they're kind of creating the knowledge. So they're not just subjects or people that we're studying and observing, but they're really actively involved. And we also acknowledge that the researcher is an instrument in the research process, because You bring your background, your views, your experience to how you ask questions and how you probe and things like that. You're really part of forming the results as well. So I'm sure you all, what are some of the qualitative data collection methods that you're aware of? I know you know them. Focus groups, in-depth interviews, participant observation and non-participant observation, right? Those are sort of some of the, you've listed all the sort of classic ones. I think another one could be considered content analysis or thematic analysis of documents or web pages or, you know, videos, things like that. So these are sort of the, you know, stock and trade of qualitative research. Some of the other methods that we often use that are also qualitative include cognitive interviews, when you know, get qualitative information from people often to improve a questionnaire or how you're going to ask things. There's some methods where you ask people to list categories of things, names of things in a certain category, or organize them into different groups, also kind of considered a qualitative method. Photo narrative and photo voice are some sort of cool methods where you give people cameras, or I guess use their cell phones to take pictures of things in their environment, and then together with them you analyze those pictures. And a lot of the community-based participatory research methods also incorporate qualitative research, because that's often a great way to involve the community in the work that you're doing. So not a qualitative method in itself, but often uses it. Nominal group technique is another type of a focus group method that I think is used a lot in health studies. So what do qualitative data look like? So we're not talking about an Excel or an SPSS file. We're talking about a very different kind of data. So a lot of it is text. So we get transcriptions of those interviews and focus groups, and we just have pages of pages of pages of text. We also have our field notes, things we observed when we're out in the field doing interviews, or memos that we write as we're analyzing our data. It's also possible to analyze audio data. Some people like to do that. People who are really interested in analyzing voice patterns and how people talk about things would actually like to analyze directly from the audio, and there are software tools that can help you do that. And then also visual data can be analyzed. Videos, photographs, art, and these all can be handled within some of the software programs that deal with qualitative research. And so basically, when we're talking about quantitative, you know, we're talking about the study of numbers, how many people practice those behaviors, and you're trying to find numerical patterns in the data, right? Whereas in qualitative, it's really more about words, meaning, and you want to understand why and how people practice those behaviors, and you really want to describe it in depth. So that's kind of the broad overview. If we just want to, again, a little bit contrast qualitative and quantitative research methods. So whereas in quantitative, we want to predict causal relationships, in qualitative, we're just really more describing we may get some ideas about what those causal relationships might be. Qualitative is you're more inducing things from the data that you see. You may want to come up with a theory based on the data you see, whereas quantitative, you might try to deduce things based on a theory. So, and this is something that always throws the quantitative researchers off, that you know, in quantitative, you usually always have to have a hypothesis, right, to begin your research. In qualitative research, you don't need a hypothesis. You often don't. In fact, in those study sections, the reviewers may ding you if you have a hypothesis for your qualitative research, because this is not about testing hypotheses. It is usually about generating them. So that's a little bit different. In quantitative, you often, to start out, you have these theory-driven relationships, among the variables that you're going to try to test. And in qualitative, if we do start out with a theoretical framework, we would have kind of broad theoretical models and actually would try to develop that later based on what people tell us, based on what we hear in the research. As I mentioned, the instruments that we use to collect the data are also very different. As opposed to structured or predetermined response categories, qualitative instruments, which are usually more like guides, are semi-structured or completely unstructured. So you might have a guide of questions that you want to explore during this focus group or interview. And there's a degree. Sometimes it gets a little bit more structured if you are a little bit more focused about what you want to find. But sometimes, if it's a really exploratory study, you might go into the field with like just 2 or 3 broad, very open-ended questions. The sampling is also very different. And I'm going to talk a little bit about that later, but you want to sample the people who can give you the best information possible about the topic that you're trying to explore. And so there's no issue of, random assignment or control groups. You're really just trying to focus on who can tell me about this experience, who knows the most, what are some of the variations in experience. The analysis for qualitative, again, is usually verbally descriptive and non-numerical, where you don't use those numerical descriptions or statistical tests. And again, that's something with you can tell someone's not a very experienced qualitative researcher if they're using a lot of percentages and numbers and stuff in their write-up. And it's kind of a natural tendency that we have. We want to say like 50% of the people in this focus group thought that condoms were bad, But, that's just not the nature of qualitative research. It's, we talk about, overall, trends, or not trends, but what a lot of people agree on in the groups. We talk about minority views. We talk about things like that. And again, in a quantitative study, right, you should be blinded to the research conditions. You should interact with every single participant in a standard way, right? In the opposite, in qualitative research, you actually need to establish a relationship with your participants. You need to open them up to have a rapport with you and be able to have an open and honest and rich conversation with you. So you actually, you need to have, and that'll be different with every single participant, and you need to be very aware of how that affects the interactions, right? But that's a very different thing. So I just wanted a few people in the group maybe to share any qualitative research projects that maybe they're currently working on, or qualitative or mixed methods. A lot of us are doing mixed methods these days. Anyone like to share something they're working on?
Working on, so I took your class last semester,
Yes.
very helpful. So I'm looking at, from a clinical provider perspective, barriers and facilitators to using palliative care for patients with end-stage liver disease. And then we're also doing a separate, looking at patients and caregivers, what their challenges and needs are.
Mm-hmm. And you're using in-depth interviews for this?
Yes.
Great.
I'm currently helping out with R1 project, high performance and high Medicaid nursing homes conducted by Dr. Robert Luis Maldonado, and we're doing a mixed methods approach. And right now we already collected our quantitative survey data, but there were some results that just weren't really kind of making sense. So as we were developing kind of the qualitative protocol, we pilot tested it with just a nursing home administrator, and we're looking at the transfer of information and best practices, and actually kind of invoking some of the responses, even just from our kind of just small pilot, really helped inform the quantitative results that we were seeing, and really kind of provided that context for that understanding. So
that's great, and yeah, that is another really good. So sometimes you use qualitative methods in the beginning of a study because you just don't know much and you want to inform what you're going to design further down. But then another design, mixed method design, as you speak of, is doing the quantitative first and then seeing, wow, we don't understand these results at all. We want to really understand more what's going on here, and so then design qualitative interviews to help you understand what's going on. That's great.
I'm working on two. One is a photoethnographic study of men, and we're doing interviews too of women who are in recovery and how they feel about their teeth, because so many of them, because they were meth users, their teeth are very damaged and have to be pulled. Or and then I'm doing another one looking at how nurses who were sort of brought up to go into the field because they feel like they're very caring people and want to take care of people, and then how the reality of the structure of the institution and the hospitals is managing that they really have no time to care. It's all about, attending to medicines, charts, checklists, and other kind of institutional issues.
Wow. So how are you using the photos in the first study?
So the photos, we at first started that we were taking pictures of them not posed and see how they would present themselves, and in fact oftentimes they're covering their mouth.
Mm-hmm.
I would try to stand back when I was taking the photos, and then we got an art student with us, and she decided to put them with a black backdrop and use it that way to see how they present themselves. And so those are very posed. And so, and they're not showing their teeth, which is interesting, but so I don't know, I'm in the middle of both of these, and I'm struggling with both of these projects, which is why I came to it. So I don't know what I'm going to do with it.
Oh, that's okay. Well, yeah, we should talk about that later. That's really fascinating. Yes.
So currently, I'm involved in several research projects using qualitative research methods. One is use photo voice to patients identify exercise barriers in the area. The other one we use nominal group technique to identify the facilitators and barriers of physical activity.
Oh.
Then currently, another one is Dr. Shin conducted a semi-structured interview with physicians to find out the one tools we developed for decision aid for the
To get feedback on this.
Yeah.
Oh, great. Yeah. Well, so there are a lot of different.
And
pieces.
also we use another card sort to try to find the patterns for ACHE patient and participants about the health service administration program in U.S.
Wow, you're using a variety. That's great.
So I wanted to ask a general question going back to the last slide about the role of the researcher in the qualitative studies, and just thinking about scenarios where the researcher might also be a provider that you're trying to elicit. So in Sandia's example, as palliative care, as a provider, if she is at the focus group and involved with participants, does that, is there guidance? Because there's been situations for us in 1917 where, you want to elicit information that's relevant to the clinic, but there's been this concern of, if I'm the researcher but a provider in the clinic or the director of the clinic, how does that influence the information that we get back? Just guidance on that tension when you're the researcher, but maybe also perceived in some way of having you're a stakeholder in the findings.
Yeah, no, we've talked about that quite a bit in my class, and it does, of course, there are different situations, but in general, I try to recommend that the physicians or the providers do not actually be the data collector in that situation. Just because, one, because especially if you're doing like a group of your clients, that's really going to have, an influence on them that they won't feel as free to talk about how they feel about care at the clinic or, experiences of discrimination or anything like that. And even with, and also like interviewing your colleagues in your same unit is also kind of problematic. Yeah, so generally, but, sometimes you're in a situation where you don't have a lot of resources and you're like, you're the only person. But I try to encourage people to see if they can get a junior colleague involved or, train someone who, and if there are those kind of influences, we need to really acknowledge them and write about them in our research, because that's an important thing to be reflective about how that might have influenced what you're doing. But in general, we try to keep away from that because it's a little tricky. So just to emphasize the differences between a quantitative and a qualitative approach. So if you had a questionnaire where you wanted to learn about women's reactions to pregnancy, and you might ask them a multiple choice question, if I found out I was pregnant, I would be sad, mad, happy, don't know, or other, and they would have to choose one of those. And so, and you can think about what that might look like, and then, but in a qualitative approach, you would ask women in a very open-ended way, please tell me how you would feel if you were pregnant. And you can see this woman says, the worst possible thing that could happen right now would be to get pregnant. I love my son, I do want more kids, but I have plans, there are things I want to do. I mean, college, my job, my parents would just die. And my friends, oh, they wouldn't understand. If I got pregnant now, I would kill myself. But the love of a new baby, that smell, that skin, oh man, that's wonderful. So you can see, that couldn't really fit neatly into those categories. So if you really want to kind of understand the complex way that people experience things, you might want to use a qualitative approach. And, just sometimes in surveys when we do have quantitative categories, if we haven't done some good qualitative research beforehand to figure out what all the categories should be, we sometimes get ourselves in sticky situations. Like this was we had this on a survey that we did in rural Kenya years ago, and this was like standard from demographic and health surveys or something, but we found out like over 50% of the people in our survey checked other. And then we were like, wow, what do we do with that? We had no idea. And, it was, there were people that were sort of in these African Christian churches that didn't really consider themselves just to be Christian. So there was this whole category of people that we sort of missed out on and didn't understand. So that's just a warning. So we don't always get the best results with these kind of surveys if we don't really know the realities. And so, starting out at least with open-ended questions could be a better alternative and release the participants from using, being stuck in those predetermined categories. Now, I'm not going to have a lot of time to go into this, and this is, again, if you take my class, you get a little bit more depth in it, but there are different approaches to qualitative research, and those are important to think about as you're getting into this area. One major approach is phenomenology, and that's when you're really trying to understand the lived experiences of people. How do they interpret their experiences? How do they understand and find meaning in the things that they do? Another very popular approach these days is grounded theory, and in that case, it's a little bit more structured, that you're trying to actually build a theory from the data that you collect from people in the field. So you don't start out with any preconceived theory or framework. You actually want to build a theory that describes a process or behavior. Ethnography, I'm sure from the discipline of anthropology, is usually a little bit more in-depth in terms of really getting immersed in a culture or community or group and really trying to get an insider's view of how those people see their world. And so these might be more long-term studies where you might be in the field for a while. There's a lot of observation usually involved, participant and non-participant, a lot of interviews, a lot of spending time in the community and really getting an in-depth perspective. Another tradition is narrative research, which is when you're really getting in-depth. It's a small number of people, but you're getting their entire life history and trajectory. So you really want to focus, on the stories of people, their entire lives, and everything they've been through. Case study approaches are sometimes used in health research, where you want to choose cases and try to understand in depth what happened in this case. So you might, for example, You might have health departments that are very successful in HIV testing and others that don't do any HIV testing. And you might want to choose some successful and unsuccessful ones and try to understand what's going on. And use a variety of methods, observations, studying documents, interviewing people, everything to really understand the case. There's another approach in the literature called the framework approach, which really does, if you start out more with a theory from the beginning, and then you do incorporate themes that come from the data, but it's a little bit more structured by prior theory. So again, just this is a bit on phenomenology and some of the references, but really just attempting to understand how people experience their lives. And so a question from phenomenology might be, what are the lived experiences of caregivers who seek HIV tests for their children? How do they experience that? What goes through their mind? How is it, how do they react? Whereas grounded theory is less descriptive, you're really going beyond description, and you want to develop a theory about a process, an action, or a behavior. And again, it has some of the same methods of asking questions, but really you come up with a theory based on the data. And the true grounded theorist people would say that you should really go into the field with kind of no preconceived notions, like you maybe hadn't read the literature, you have no idea, you just go in and everything you learn comes from those interviews, focus groups, observations, and from that you construct a theory. But there are a lot of people that use aspects of this approach, if not the entire approach. And so in this case, you want to ask, what is the process that caregivers go through when deciding to have their children tested for HIV, as an example. So you want to have a theory that explains that process and that decision-making and that behavior. But as I mentioned, a lot of qualitative studies do use existing theoretical frameworks to start off with, and it can be a good way to help you guide your thinking and what types of questions that you want to ask. So you might, base in public health, a lot of people use socio-ecological model or the health belief model, locus of control, stages of change, intersectionality theory. So these theories are useful and they can help you decide, what types of questions to ask at what levels. So I mentioned that sampling is different in qualitative research, and again, you want to select the right people to answer your question without leaving out the people who might confirm or disconfirm your analysis. So you want to interview people who have, good experience with the phenomenon you're trying to study, right? If you really want to understand how parents decide to get HIV tests for their children, you want to, study parents who've gone through this or who are thinking about it at least. I mean, sometimes when you can choose a population that doesn't really have a lot of direct experience with what you're studying, and you don't get a whole lot out of the interviews. It's just, it becomes a lot of hypothetical or, kind of stuff. And when you're doing observations, again, you want to choose where you can really observe something going on that you're interested in. So some of the different methods that are used for sampling, people use terms like purposive, or in grounded theory it's called theoretical sampling. So then you're really just trying to sample the people that can best inform your research and your developing theory. So, and you really want to choose those people who have in-depth experience, but often you want to get kind of a spectrum of different types of experience. You want to make sure that you're not just talking to one part of the group, right? Often you may have quotas in your qualitative sampling plan, like you want to make sure that you get, at least 5 or 10 interviews with people under 25 and 5 or 10 interviews with people 26 and older, gender. And those are really, you have to think about that beforehand. What things will really influence this behavior? Do I think that race is a really important factor? Do I think that marital status is important? So when you're doing that sampling, you want to make sure that you capture some of the variation of that so you can see how it works in different groups. Some studies do use snowball sampling in qualitative research, and that's often when you have a hard-to-reach population, people that are not easy to find and, sometimes don't want to be found. But if you can talk to someone, for example, it might be a sex worker in downtown Birmingham, you have a great interview with someone and you say, I really, enjoyed talking with you. Can you recommend to me 2 or 3 other people that you know that would also want to talk to me about this? And you can go on like that. There is a technique which you may have heard about in respondent-driven sampling where you kind of combine this snowball sampling with a mathematical model that kind of, so again, you do have people refer other people, but you keep track of who refers who in the networks, and that's another slightly more systematic method. And just to show, this is a study that we did trying to understand why some pregnant women didn't use maternity services in a rural Kenyan community. And so here we did a total of 48 qualitative in-depth interviews, and we tried to talk to all the different people that we knew would be involved in this issue. So in each community, we did 4 pregnant or postpartum women. We did 3 traditional birth attendants, the ones who do the births in homes in the community. We did 3 male partners or other family members because we knew that men and other family members were also involved in these decisions. And we also interviewed community health workers who knew a lot of these families. So that was how we did the sampling for that study, but there are a lot of different variations. Other questions at this point about sampling or?
So I guess I'll interject a little quantitative bias, if you will.
Sure.
But when we do a quantitative study, we do a power calculation to try to avoid a type 2 error. And is there any way to, I think you've outlined some strategies to try to address the generalizability issue, but I guess I still always worry when we do small numbers of individuals to try to learn something broad. Are we missing something that is there because we didn't talk to enough people?
Yeah, and it's always, it does vary a lot from topic to topic. I think we try to make sure, when we're doing interviews that we have at least, 5 to 10 people in each major subgroup that we're going for. When we're doing focus groups, we try to do 2 or 3 groups per each cell or subgroup so that it's not like, one group or one person can really, but I think we just have to keep in mind that we're not, that we're really going for depth, and that we always qualify and talk about our sample and give those caveats. But I think, it's always a challenge to think about that and to justify that to your reviewers. Go ahead. Mm-hmm.
Well, at a certain point, you would reach saturation point.
Yeah, and that was actually, thank you, next point. Very good. So there is this concept of saturation in qualitative research that, again, it's very dependent on your method and your question and your sampling strategy. But more is not better in terms of qualitative research. So saturation is, meaning that, and when you do qualitative interviews or focus groups, you will notice after you do a certain amount of interviews and you keep going and keep going, you start to hear the same things over and over again. So when you get to the point where you're really not generating any new information, then, you've reached saturation. There's no need to do, I've seen studies where they did 100 in-depth interviews, and you're like, why? It's like, it really is usually not necessary because you do exhaust most of your themes after a certain point. And so usually when we're writing, at least an IRB protocol, we like to say that we're going to do up to 40 in-depth interviews with this group, and then be coding and analyzing as we go, so we realize at the point where we really have reached saturation, we've exhausted, we've got all the information we need to really answer the questions at this point. But they're not real clear guidelines on specific sample size numbers. It really is very dependent on the topic. So as I mentioned, the analysis of qualitative data involves, coding and classifying the observations, the texts, and deriving major and minor themes from those. And so when probably you all have read qualitative papers, and you see that a lot of the data that we present are the quotations and the words of the people who we interviewed or were in our focus groups in the study in their own words. So giving voice to those people's words is an important part of qualitative research. Now what you do end up with is, when you do a full qualitative study, pages and pages and pages of transcripts and data. I mean, it's a lot often to digest. And there are different strategies that people use to try to kind of, make sense of this. My colleague talks about the lumpers versus the splitters. So some people like to code their transcripts in very, very fine detail initially, every little, kind of sub-theme or code or thought, and then later they lump it into larger categories or themes. Another approach is to, start out with big major themes that you want to code for, and code for those first, and then within those big kind of themes, then do a lot of fine coding about what actually emerges from the data from those. So it's a preference, and people like to do it different ways. I kind of like to use the bottom approach because I often have some big themes and areas already from my research question and my guide that I know I want to code for, and then coding those and then going within those to say, okay, if I'm interested in barriers to vaccination, now I want to go in and say, okay, what specifically did people say are barriers to vaccination? Is it transport? Is it cost? Getting down to that level. And this is Dr. Eva Kova, who is another resource on campus that people may know, who does a lot of work in mixed methods. And, her approach is I think more to start out on the very fine detailed level and then collapse into a smaller number of themes. Fortunately, we do have software that can help us with this. And again, the packages that are available, like NVivo, Deduce, Atlas TI, they are tools for organizing, reviewing, coding, and analyzing qualitative data. They will not actually analyze the data for you. It's more almost an organizational tool, but it's something that can help give structure that you can actually, review your transcripts, apply codes to blocks of text, and then later retrieve those in an easy way across all your interviews. It's not like you could dump your qualitative data set into the program and then get out your analysis. It really is you, the researcher, that have to do the analysis, but it is really helpful to work with these programs, and they can be used to work with different types of data like video, audio, pictures, whatever, which is cool. You can just see it's from NVivo. So again, why do we want to incorporate qualitative research in what we're doing? And especially, sometimes the thing that we're studying, we can't really study it quantitatively. Maybe it's the behavior we want to watch is so deeply culturally embedded that people can't even really, talk about it. You need to observe it. Or it's something in the history, or maybe it's with small children. We talked about the lack of congruence between survey responses and what people say and they do. So sometimes people, you'll see on a survey that you ask people, how satisfied are you with the health services at this prenatal clinic? And everyone says, very satisfied, 100% satisfied. And then you notice that nobody ever comes back to the clinic, right? And so that's a good way to look at use qualitative research. It can be good for very complex situations, and it again can be good when you want to involve the community or participants more in your research. I don't know, Dr. Charrington, have you used qualitative research in some of your CDPR projects?
I don't think we've ever not done it.
Exactly, because it is a method that community members can learn and be involved in and really contribute to. So that's and understand, so it's great.
I think you have to make that. I think especially so the work that I do, a lot of it's intervention based. And so I think one of the big arguments for using qualitative research, which when you say it, it's kind of obvious that if you are trying to design an intervention that's going to resonate with somebody, you really want their opinion on the front end so that at the end of the day, that's the result that you get. Because if you go in thinking you know the answer and create something that then you present to someone when it's all packaged up and done and they say, I hate that, you've wasted all this time. So I think of qualitative work, especially in the world of intervention development, really as a pre-marketing strategy and really getting people to help you come up with the messages, the content, really everything about it. You can't do without inviting people to participate.
Let me push back just a little bit. I think that sounds very appropriate, but I wonder sometimes, particularly when you've got a group of clinicians who have relatively regular encounters with people with condition of interest where you want to design an intervention, so they're basically doing qualitative work in essence by the encounters that they have, although maybe it's just one-on-one. But say you're dealing with a particular disease state and you, as a clinician and your colleagues have seen hundreds of people with this and have been talking to them over many years, I sometimes feel like you don't necessarily get any new information and you're kind of just jumping through a hoop to show that you're collecting that data, but are you really going to learn something new?
Yeah, I think that's why our adherence rates are abysmal. Because I think for years we've thought we know how to do it. And that's why, when it goes according to plan, we do well, but I think there's a whole host of reasons that people don't respond in the way that, if you think about it very medically, it just seems counterintuitive, but there's really good reasons that that's happening. And I think unless we get in touch with what those reasons are, and
I'm not saying in all circumstances, but in certain ones, I just wonder how much additional information we glean.
And usually we often do interviews with both providers and clients, and there often is a lot of overlap, but there are always things that the clients tell us that are coming really out of the blue that didn't always come from the provider interviews, I would say. I mean, I feel like, and again, using those, non-clinician researcher people to really build a rapport with people and get them to talk about stuff that they don't always talk about with their provider.
The other thing I would add is I think where I do think it's risky is, when we do work with a group and then you try to extrapolate the answers you hear to the entire group, I think you miss out on the individuality. So I think we always have to, because you don't want to stereotype or pit people in definite buckets, but I think there's certain thematic things that we need to just have at the top of the mind while you're trying to design something for a particular group, but always being open to that individual.
Right. No, I accept that, and I guess the other thing that I've encountered, and I think the adherence thing is a great example, because we've looked at that, and we've actually done in osteoporosis, been very interested in the issue of adherence and how to design interventions to improve that. But what we find often in the qualitative phase is we get a lot of feedback on things that we can't fix. People can't afford their medicine, they don't have access. Problems that are societal issues to some degree, and where there's no intervention as a health system or as a healthcare provider that you could imaginably come up with.
But although so to push back on that, so here's a really cool example where I think somebody's thinking out of the box and doing, trying to address those very things. I think we like to fix everything, and then, we are confined by what we're sort of allowed to do. But I just heard about a program in Geisinger.
Not allowed necessarily, but we have resources.
Well, you're true. So I just
love
heard
to change
about
health policy, but I don't have the resources.
We continue to advocate that. But I think Geisinger right now has a really cool program where they're doing sort of a prescription for food to try to get around food insecurity as a major barrier to healthcare. So whereas they, have sort of a prescription program and they pay for drugs, they're piloting this new intervention
We
around.
have that in
Prescription for food, to
drug
try to
prescriptions.
say, here, the root issue here is that there's food insecurity, and that's what's driving obesity or
Right, so
whatever.
I think maybe even if you in your hospital or clinic can't do something, it still actually informs the field and
You have
people
to
that
know
are
it's an
developing
issue.
interventions
Yeah, yeah,
like
yeah.
that. There's a lot of focus on structural interventions right now.
And I think the P-Core movement really
Yeah.
it addresses this, the idea that, and broad stakeholder engagement, so participants and providers and health insurers getting those perspectives. But I would say, Janet, even beyond like the informing the intervention, like we've seen, I think, in our field, multi-million-dollar international trials where epic fails because people didn't ask women in Africa, would you use a gel or a pill or something? I mean, so I think it speaks to the idea of even with the best biomedical science showing that this is 100% effective at preventing this, that, or the other, without assessing before doing these large-scale trials, sometimes you have missed opportunities where it's like, yeah, it works biomedically, but are women going to use this product?
Right, and they're not going to use it because of fears of stigma or fears of their partner or whatever, things that, make a huge difference. So again, we use these methods when prior knowledge is lacking or inadequate, when we want complex situations, and sometimes we want to develop a new theory about why and how people do things, and in detail. Now, there are some critiques of obviously of qualitative research. People think it has lack of scientific rigor, or they think it's just journalism or reporting or just like anecdotal stories. They worry about researcher bias that we talked about, and they complain that it's not reproducible and it's not generalizable. And so those are some of the sort of the common critiques. I think, as we go on, qualitative research has developed a lot, is much more sort of systematic and well known by researchers, that you won't come up with these criticisms quite as much as we used to maybe, 20 years ago. But I think there are some standards to really show when you're writing up qualitative research that you're doing quality and rigorous work. So these are kind of the things that you use to judge qualitative research. So how credible are the findings? Are the findings, do you have confidence in the truth, and is there an accurate understanding of the context? Dependability is really important. So is the research process carried out in a consistent way that is, using the rules and methods and structures of good qualitative methodology? Can the results be confirmed? So can you confirm by audits or other methods that the data really, as accurately as possible, reflects the participants' perspectives and experiences? And we don't talk about generalizability, because we really are saying that these findings are very, specific to this group, these people that we interviewed. But often we can argue that some of our findings are transferable to other populations, very similar populations. You don't want to say that it's maybe directly generalizable, but I think we often do find some things that may be transferable. So it's important when you're designing your research to kind of build in measures to check the accuracy of your findings. So you probably want to try to triangulate with other methods. You may have, if you do have quantitative methods or other types of methods that you're using within your study. We do something called member checking, where after we've done some of our analysis and gotten our themes and findings, we go back to the community or to people, the participants, and present them and say, what do you guys think about this? Does this accurately reflect what's going on? Are there things that we've missed? Giving really rich, thick description of your findings, I think, helps to show that their truth and accuracy. If there are biases, and often, there always are some sort of biases in either who you talk to or who you are talking to them, you need to clarify and bring those out. You need to present any sort of cases or things that are sort of, you may come up with a general theme, but then you may have some minority views that really contradict that, and you need to bring that out because you've got, a sample of 20. So you need to say, on the other hand, this person in our sample thought that this was a terrible idea, or, spending a good amount of time in the field, doing, really getting to know people and setting, debriefing with your peers on your research team. And, it's rare that it happens, but sometimes there may be an external person who could come in and observe interviews and confirm things.
Hey, Janet.
Yeah.
One of the other things that I think is really helpful in this is involving a really diverse team, if you can, in the analysis phase. So, I know I'm an internal medicine physician, so I have a certain lens.
Right.
But if I can work with, and it's been great even working with students who have no preconceived ideas whatsoever, or very different preconceived idea, or involving someone who's a medical sociologist or a clinical psychologist, and you'll find when you sit down to discuss things that really everybody is seeing it through a different lens, and I have found that to be very helpful.
Yes,
as well.
absolutely. Yeah, it's really great. I mean, I much love to do coding analysis in teams like that, because you really get these different perspectives. And again, for reliability, you just try to use an approach that is consistent across different analysts and projects. So when you do work with a group of analysts, you need to meet together frequently and make sure you are all on the same page about, the coding framework, what this code means, when do we apply it. And that takes a lot of intensive work, but that really improves the quality. And there are actually methods to calculate like inter-rater reliability in qualitative coding, and if people want to do that. And again, your focus of your research is not on generalization to the entire population, but more on the particular aspects of this population. So if we want to demonstrate rigor, we need to have systematic and self-conscious research design, data gathering, and interpretation and communication. So you really want to create an account where when you write up what you've done, that, theoretically another researcher could analyze the data the same way and come to essentially the same conclusions. Actually, I'm contributing to something right now, which I have some questions about it, but a researcher at Harvard is asking a bunch of us to send in our qualitative data sets and our coding frameworks and our results and analytical reports, and they're going to try to reanalyze the data and see how long it actually took to achieve saturation to get to those themes, and try to give some general guidance in the field, again, about like how many interviews do you have to do. I mean, I'm a little skeptical because I feel like that's so variable in different studies and different research questions. But again, they're going to try to replicate everything that we did by a different team.
And Janet, the other thing that comes up, I never thought about this until now, is with NIH's push for rigor, reproducibility, and transparency.
Yep.
But quantitatively, we think about, great, here's my data set, I can hand it to anybody, they can run the same SAS code, but like, from a qualitative perspective, it's more complex thinking about the whole issue of R2T.
It is. It really is. But at least we have some, and I think the more you'll see if you read a good qualitative article, and I can provide examples, they have a lot of detail on the methodology, and there are standards for reporting, so you really can see that rigor within the methodology. So, as we've mentioned, NIH now, does fund qualitative research. It's most of the work proposals that I see are mixed method studies. It's rare that you see a completely qualitative study, although I think some of those do exist. But there is a lot of interesting qualitative research. There's a lot of recognition of the value of qualitative research. And I think, there's some guidance just that, again, when you're describing qualitative research in your NIH proposal, just make sure you are very systematic, clear, and specific about what you're planning to do. It is true that a lot of the reviewers may not be, so familiar with qualitative methods, and so you have to be very careful about your language, defining your terms, and, making it very clear how this is systematic and rigorous. in the specific aims, of course, you know, in general, you would have your aim and then of course, your hypotheses to be tested, right? But in this case, you may, for your qualitative aim, you may have more broad, open-ended, and interconnected questions that usually are not stated as hypotheses. And so that can be a little bit of a challenge, but again, as we mentioned, if you do have qualitative experts on the study section, they, if you put a hypothesis, they're going to criticize you for that. So we often, use verbs like explore, in-depth, examination, things like that that talk about what we want to do. And also you have to get them used to the idea that you may have insights that emerge during the qualitative research that may steer the project in different directions. And I think that's one of the biggest challenges from the IH proposal point of view, because you're going to do some qualitative research and you're going to say that it's going to inform your intervention, but you can't just have your intervention be a black box, right? The reviewers are going to hate that. You have to be, you have to anticipate what your intervention is going to look like and say that it's going to be informed by the qualitative work. So I think it is a challenge. And when you're in your writing, your significance innovation section, you may need to include some literature or discussion of the qualitative methodology itself that you're going to be using, again, because the reviewers may not be as familiar. In the design, your research methods, you need to talk about your overall approach and rationale. Why are we using qualitative methods? Why are these the methods that we have to use for this aim of the project? Why is it most important? And you need to demonstrate that you have the team, the qualifications, and experience to do the work. So if you don't feel like you have the qualifications or the experience to do really strong qualitative research, you need to bring on team members to work with you who have that, or show that you have mentors who are going to help you do that. And again, that could be something on the study section. You say, well, they say they're going to do all these, in-depth key informant interviews, but nobody on the team has ever done this, and that's not going to fly. In your design and methods, you need to talk about your overall qualitative or mixed methods design. Again, sampling, how you're going to gather the data, details about the data management, the coding, the categorizing, the analysis, and demonstrate this rigor and trustworthiness that we talked about. So I think, yeah, sometimes you can see proposals where the qualitative piece is just kind of skimmed over, and then we'll do a few focus groups and blah, blah, blah. That's not going to be enough. So again, this was from this workshop that was a while back about qualitative research and NIH proposals, and it just saying, watch your language. Most reviewers are more familiar with quantitative methods. Many concepts may have different meanings and may be applied differently in qualitative and quantitative contexts. And, so, you may say a theoretical or purposive sampling method will be employed, or data will be collected using semi-structured interviews and participant observation, but you have to go a step further and explain what that is and have references. Yeah, exactly. And just orient reviewers to the method, So description of these methods and, with references to people that use them and maybe, studies that have used this methodology previously. I don't know so much that it's necessary to give a rationale for qualitative methods in general these days, but still it could be, but rationale for the specific methods you will use, like why you're going to do focus groups versus in-depth interviews. That's always a big question, and that people struggle with, and you need to give a rationale. So I want to, any other questions or comments at this point? Yes.
So I had never heard of the framework approach, and it seems like that's what in my world, often when I review, people say they're using grounded theory, and then right away they say here's my theory.
yeah.
And I was like, no, you're really not using grounded theory. So I tell them, when I'm a reviewer, I usually say you're using a modified approach, but maybe I should be saying use a framework.
Well, yeah, it's actually was developed by a British group, and I can send you the reference for it. And the only thing is, I think that the wider community is not so aware of that method, or people haven't really heard of it. So,
but it sounds perfect.
yeah, no, me, I was like, this is what I do. Perfect. But so yeah, that I can
I also
share
think
that.
people incorrectly use grounded theory all the time. If they say, and they'll do it in a response to it, somebody will say, well, what approach are you using? And they'll be like, grounded theory. Yeah. But they don't really know what that means.
Right.
Okay.
And yeah, and it's because grounded theory is very structured, and there are a lot of steps and specific types of coding that you have to do, and it's really, a lot of times people like it because it's almost like quantitative research, the amount of structure that it has. But I like to, in a lot of our studies, it's more informed by some of the principles of grounded theory, especially like being, your findings really being grounded in the data. So,
any guidance you can share? I think your point is a really good one about when you're doing the mixed methods or a qualitative and a quantitative study to inform an intervention. I feel like we've had probably an increasing number of folks putting in, out of this group, K awards with that kind of a model and getting the feedback about interdependence of aims. You know what I mean? So this idea of the qualitative to quantitative, any general guidance that you found successful in terms of, I think we have examples. It happened with Jesse Merlin, it happened with Greer Burkholder. It's just so, just the guidance to your point about, being able to frame, we're doing this exploratory qualitative work, but we've got some sense, any things you found particularly helpful to kind of win over reviewers when it is, by definition, somewhat, exploratory or for, the qualitative work.
Yeah. I mean, I feel like my strategy has been more to specify the intervention more than I actually really, would.
Yeah.
Just because I feel like to leave it open. I mean, make it clear that you're going to tweak, inform, add other aspects based on the qualitative, but you really feel that, your preliminary work have informed that this is very likely what the components of the intervention are going to be. I mean, I think that it's been a more really trying to give a structure for the intervention, even though we know it's going to be informed by that qualitative. But I don't know, in terms of interdependence of aims, people say, oh, what if you find in your qualitative that this is a terrible idea kind of thing?
We've seen both things. It's been both things. One has been the kind of idea, I think that strategy sounds like a really good one. The other has been, you're worried about, medication adherence to blood pressure medicines, people living with HIV. What if in your qualitative work, they don't really care about that, and it's something entirely different? I mean, so that's something else that's come up, I know that, we've worked on trying to address.
Right.
But it's a separate
maybe you
question.
can also cite other, qualitative studies done elsewhere that have found that this is a real priority for people, and that lead you to think that, that. But it is a balance. Any other thoughts or comments? So we have until 9:30. And again, it's my fault for starting late. But I just was going to give you an example of one study that I've done recently here in Alabama, just to give you and this was a mixed methods study, and it was looking at the role of reproductive stigmas in pregnancy decision-making in Alabama. And this was a study that was funded by a foundation, the Society of Family Planning, and had a lot of different people involved, including Whitney Rice, who I believe is one of the fellows here. And just in the context that we know in Alabama, 55% of all pregnancies are unintended, and the majority of these result in a birth. And we also know that there's a high representation of religiosity and low education. And so these are groups that might likely experience and feel stigma around induced abortion. And we also know that social disapproval of abortion is very prevalent. And there are increasing restrictions on the availability of services. That's kind of the context. So What we actually wanted to do was not only look at stigma around abortion, we also wanted to look how other reproductive choices that young women might make might be stigmatized. So is there stigma around giving your baby up for adoption? Is there stigma around keeping the baby if you're a young, adolescent girl and you have a pregnancy? And so we started out, again, with a very open-ended qualitative approach. We wanted to explore these perceptions of reproductive stigmas among young women, and we decided to use focus groups, and we knew from prior research, again, that there were some difference among racial groups in some of these attitudes. So we decided to do 3 groups with white women and 3 groups with black women. They were all aged 19 to 24. We recruited them from the health department and also from a local community college. So based on the results of those focus groups, we developed some ideas and measures and domains related to these reproductive stigmas and developed a quantitative questionnaire. But then we wanted to make sure that that questionnaire was really working and that people were understanding the items the way that we understood them. And so our next step was to do a series of cognitive interviews. And this was only with 12 women. You don't usually need a huge sample for cognitive interviews, but where we went through the questionnaire items with them, we got them to give their open-ended feedback about what they understood by the questions, the processes they went through in their minds answering the questions, and we used that to refine our tools. And I remember something that we were really focused on stigma experienced by young women when we were doing this study, but then when we got to the point of cognitive interviews, actually several people said, well, what about the guys? What about the guys that got us pregnant? What do people think about them? And so we ended up adding a whole new scale about, attitudes toward young men who are involved in a pregnancy, and so that was a whole new thing that came out of the cognitive interviews. But then we used this then to refine our questionnaire. We made a quantitative questionnaire where we wanted to, again, assess the reliability and validity of these measures and assess the association with some outcomes. And so we developed a 20, 30-minute iPad survey that we conducted with women aged 19 to 24, recruited from health department clinics. So that was the whole sort of mixed methods design, and we found some really interesting stuff in the qualitative work. We found that all these young women are saying, okay, yes, the right thing to do is that you should only get pregnant if you're in a monogamous, stable relationship where both partners are educated and financially stable. That's what it should be. And then, of course, everybody said, however, in reality, pregnancy occurs outside these circumstances all the time. Happens, we just see it, daily, and the expectation is that those young women should give birth and raise the baby no matter the circumstances. And the majority, most participants also felt that both abortion and adoption were unacceptable alternatives to keeping the baby. And they talked about women who did those in terms of a lot of negative, these are young women themselves, but negative labels, social judgment, non-disclosure, just those people are, selfish, irresponsible, heartless for both adoption and an abortion. Yeah.
Did you say this, or not? I know you recruited from the health department and from the community college. Have the women had a pregnancy?
Not necessarily. It was mixed.
Yes. So some had it.
Yeah, some had, some hadn't. Yeah, and so it was mixed. It was not.
I wonder. Yeah, that's very interesting. Whether you should have groups that have and haven't, and whether.
Well, obviously, because it very much influences how you
The other thing I wonder about in terms of sort of the concept of saturation and generalizability is, did you think that the results of this would generalize throughout the state or just to the women who were being seen at a health department or attending community college? In other words, what if you had included
included groups from a sorority at the University of Alabama.
Right, no,
Yeah, different.
I think we would have, and actually, the interesting, in order to get the white groups, we had to go to like Morris. And
So I guess I'm not even focused on
Yeah.
race, ethnicity,
Yeah.
it's just about SES and whether that is a major driver of beliefs. Maybe it's not, but how do you know that it's not?
Yeah, I mean, this study was we were focused on low-income women more in general, but I agree that, I mean, that's something you have to talk about in your discussion of the qualitative methods, of like who this is really relevant for, who did we talk to, and we could get very, very different views, I agree. And, we did see some different themes coming out from groups from different racial groups. Here are just some quotes. Keeping the baby. Most of the pregnant young women in my community, they choose to keep the baby. That's the main option. They see no reason for abortion, adoption, or whatever, because keeping the baby is just so common. And here's something about adoption. I don't get it. I was financially broke, didn't have no money, and my kid's well taken care of. The father, and they're talking about the father of another participant's child. Don't help her, and that baby looks so healthy it ain't even funny. It might be hard. There's things out there to help women to make sure their kid is taken care of. So I don't understand why women do that. And here about abortion. Yeah, I know plenty of people that have had abortions and don't even tell their doctors. They're ashamed of it. They go with like a hood over their face going to that place, Planned Parenthood. They know it's wrong, but they think that's what's best for them or the child they're ready to have or whatever. And here's another participant. How could you destroy a life? How could you not give the baby a chance? You're making that decision to just not even let the child fulfill its potential at all. So these kind of findings inform the development of these scales that we came up with, where we were assessing the perceptions of young women who have an accidental pregnancy, who keep the baby or give the baby up. And so talking about their perceptions of how common it is, their opinions about young women who experience it, stereotypes. We're also asked about what they do, what others would expect them to do, whose opinions would matter, how people would react, common beliefs about a young woman who experiences that, and also common beliefs about a young man who experiences it. So, I mean, this research is going on. This measure now can be used to predict reproductive decision making and also women's healthcare utilization after some of these events. And so just to wrap up quickly, so I think you're probably getting a sense that qualitative research is complex, it's demanding, it's time consuming, and it can be expensive in terms of mainly the time and effort of the coding and analysis team. But it's also really engaging, it's really satisfying, it's really even fun. When you read these quotes and it seems so real, and also just the interaction with the participants is very satisfying. And what you can get out of it is in-depth understanding of, complex problems and how people live in the world, and hopefully you can develop programs that actually address the real needs of those people. So I really encourage people to get into qualitative research. I will be giving my class again next fall. It's on Mondays from 11 to 2:30, I want to say. And so please, we'll be putting out some announcements, and I'd love to have people from this group in that class. It brings a lot of richness, so I'll look forward to that.
Thank you.
Okay.
You might have a minute or two for a question. Do you have a question? Advice? I have a question. Yeah. If you want to do cross-culture validation or a questionnaire, but you are going to keep the same language, but you're going to test it among different cultures, different populations. Do you consider the subgroups within that population, or you just do the one group assessment thing?
In terms of, like, if you wanted to qualitatively explore whether that...
If it is like if they understand it the concept of that questionnaire because it has never been tested among that population before.
I would definitely do subgroups. You may think again, you know from your experience, your literature, your preliminary studies, what are some of the important characteristics that might, cause people to experience this issue differently. So, and when we try to do for example, the cognitive interviews, we try to get a spectrum of race, ethnicity, different economic levels, so that we would kind of try to see it in different groups.
Absolutely. When you mentioned that you don't need a lot of people within the cognitive interviews, is it going to be same application for each subgroup, or do you consider the total?
I mean, we have a guide, so for cognitive interviews is often what it is like maybe you would have people like do part of the questionnaire, then you would stop and then have a series of open-ended questions, and then you would have them maybe do some more of the questionnaire. And I mean, we usually use the same guide for all groups, but then we realize that different people react differently and have different responses. So you don't need a separate guide, but...
Thank you. Great. So I think an obvious example to sort of flesh out what you're talking about is, sometimes people say they're adapting a questionnaire to use with, Latinos living in the United States. But then they run into the fact that just even people from different countries have very different languages or words that they use for various things. So I think to that end, you do have to sort of decide whether you're going to use it specifically with one group or whether you want to try to have something that has universal meaning and appeal. So it really sort of depends on what it is you're trying to achieve, I think. But I think having attention to those differences is really important.
Thank you again.
Okay, you're welcome.
Oh, and I'm sorry, I have an announcement.
Really clear. You ended on time.
Well, there's
We've heard of the interaction.
I saw that. I immediately wrote to Kaylee and went, yeah, this is a screen through, but I've been worried about that.
And we're still waiting on the straight up work on the first slots, but fingers crossed. It's a great training ground.
I want that. Ask you advice on so I just was not for the sake of but then when I I guess that'll change. Yes, that's kind of where I'm struggling, but really, my plan is to work some of those groups just so that I can, feel like I did. Are you going to this year? For the further representation of PA,
But I don't know if you just want to maybe, you'll probably get some of that diversity improvement, right? I mean,
Yeah, and I already have.
Okay.
I'm just curious from where you're is that something that people look at? Like, 50%
I'll be presenting it.
let us know practice. Various
Okay,
Yes. You can't have your analysis and see, well, blacks and whites. I got this differently.
My question was, I know we talked about it in the past, but do you know if there's any like coding workshops on campus or anything like that?
I mean, we're thinking of having one actually. Most of, some of this work that I do is through. We have that she allowed to do. What you're.
Well,
I mean, you know what I mean?
Well,
But I'm thinking that she suggests
when
that
we
we.
were really started school.
I'll do. I research, and there, I know that there, because we actually did have sometimes hard time finding people in these workshops. Or they opened it up to modern help you research. I definitely have.
Oh, yeah.
Yeah, we have, you know, like in the past, we sponsored like a 3-day workshop with someone from North Carolina doing a special needs.
She's the one that.
Yeah. But also, there are courses at universities, especially at
Oh.
North Carolina.
No, well, I mean, I'm
So
somebody
you
in
may
the park.
have 3 to 5 days short courses you can go to, and those have been really helpful for people.
Okay.
Yeah. You guys, you know, it's in the same school district, so they know you go on.
I mean, we would consider.
Thank you. See you in a little review. I didn't see you. How are you doing? Good. I was like, oh, one more time. Nice to meet you. Here. I must have done 2 times. I'm like, just on my calendar. For no. I mean, it's not possible. I'm sorry. Okay, and then I just chatted with you. And I was like, oh, jumped in my car. You did it here. It's like a team Saturday, and I'm here. They plug in.
Oh, yeah.
So,
So the other thing is that, you know, I wouldn't have to be there at 8 a.m. or anything like that. Lots of stars.
It's terrible. It's just not
I
what
think
I
meetings
want
are always
for
at
you.
noon, you know, so there's never.
Oh, of course. Six. Yeah. So, yeah. 6:28 is the master's level, and 7:28 is the doctoral level. Are you like a clinician, or what's your?
When they,